Hi pals, it's me Artie, then in pronouns only. My video this week is talking about how I went for a tilt table test and just kind of a bit more about that experience. So I can't remember when exactly it was, but I finally spoke to a cardiologist. I do believe it was a registrar on the phone because there was so many people on the waiting list to see people in cardio in my area. I was also told that I wasn't going to be seeing someone until May of this year, which would have meant I think my referral had like a nearly 2 year wait to even just have a first appointment with a cardiologist. So they decided to start doing, I think, some extra phone clinics to kind of triage people and decide if people needed to go get tests done, at least they could be put on those waiting lists, which can also be quite long. So we spoke about what symptoms I have, a bit of the history, what things have helped and what haven't. That wasn't a great phone call, so if anyone would want to know a bit more about it, let me know. Maybe I'll make a video about that as well specifically. They did book me in to have a tilt table test, which is one of the main tests when it comes to POTS or like other dysautonomic conditions, I guess is the right phrasing there. Like I said, I can't really remember when I had this phone call. I think maybe March. I really cannot tell you. What is a tilt table test? So a tilt table test is used to evaluate the cause of unexplained fainting. Whilst I have not personally ever fully fainted, I have had a lot of pre-syncope over the years, which is basically that horrible bit before you pass out. A healthcare provider might recommend a tilt table test to evaluate repeated unexplained episodes of lightheadedness, dizziness or fainting. The test can also help determine if the cause is related to heart rate or blood pressure, and the test is basically to try and trigger the signs and symptoms that you experience, like I guess day to day. So mainly the lightheadedness, dizziness and fainting, while monitoring your heart rate and blood pressure, because like the main thing that they're looking for when it comes to POTS is like if your blood pressure drops when those symptoms happen, even though I don't think that's entirely a requirement for a POTS diagnosis. There are lots of people who get diagnosed with POTS who don't have a tilt table test, I'm pretty sure. But basically the nervous system controls the heart rate and blood pressure, so it may suddenly lower the heart rate and blood pressure for a short time when moving to an upright position during the tilt table test. And as a result, less blood flows to the brain, possibly causing fainting. The general gist is that you get strapped onto basically a bed and they tilt you up. And that's kind of it. A lot wasn't fully explained to me before I got there, so I wasn't really sure what I was going in for. Obviously I've had friends talk about their experiences doing tilt table tests, I was under the impression I'd be tilted around quite a lot, quite rapidly, more than once, etc. But also it does seem to vary from place to place. A friend of mine said that they were tilted more than once, whereas I was not. My own personal preparation for the test, the doctor I spoke to on the phone interrupted me quite a lot, so he didn't actually end up getting the full list of up-to-date medications that I was on. And obviously I'd already started propranolol because I was feeling this constant fight or flight, which to me makes it sound like it's likely I do have POTS, because that's an autonomic dysfunction, really. But hey, we'll see. Because I was in that state all the time, I basically just needed something to help with that, at least for now, until I got to a cardio and got this investigated more. So I personally decided to come off of it for a couple of days to make sure that the test was more accurate to my actual non-medicated experience. And I also did choose not to eat for a good few hours leading up to the test, because I wasn't really sure what to expect, and quite a lot of the time my pre-syncope comes with this feeling of like extreme nausea or like I'm going to be sick. So I didn't really want to worsen that feeling by having like a stomach full of food. But other than that, I don't remember being given any like specific instructions. But I just thought that if it's going to trigger symptoms, a big one I get is like that nausea with dizziness. And when I got there, they were a bit confused about me coming off propranolol, me being on it, etc., because it wasn't written down. So yeah, I did sort of explain to them that whole experience. So I was obviously off the propranolol for a couple of days, and I started experiencing like pretty bad symptoms again. Mainly was like a really high heart rate. It was often reaching around like 140 to 150 when like just standing around. Really breathless, especially when talking. Hot flushes more often, brain fog, and like my note here is that, you know, if your blood isn't really reaching your brain properly, then like, yeah, brain fog makes sense. Dizziness, wooziness, chest pains, and then they did say in my testing appointment that my blood pressure was, I don't know what exactly the blood pressure was, but they did say it was high. And yeah, my blood pressure has been verging between high normal and just high. I don't know if that is the case whilst I'm on propranolol anymore, because I haven't really tested it, but yeah, just another thing to note that my blood pressure personally was quite high. What I expected from the test is that I really thought that it would involve multiple tilts, but apparently in my area they only tilt you once. And like I said, I have friends who said that they were tilted multiple times until their symptoms were triggered. Yeah, it didn't really help that the doctor I spoke to on the phone didn't really explain it. And at this point, I really struggle with keeping up with letters in particular. So if there was a bit more description about what to expect, then in like a letter, then I didn't read it because I'm just so overwhelmed with paperwork, to be honest. So what actually happened in the appointment, I had a group of 3 healthcare workers conducting the test and monitoring me. One of them was a doctor, I think again a registrar, and then 2 other staff who I'm not really sure what their job role technically was, but they could have been like a healthcare assistant, a tech, or a nurse. I'm not really sure. They were just both wearing the same blue scrubs. Everyone in there was very nice to me, which is sometimes a very shocking experience. I have noticed that my experiences recently in my local hospitals is that the people conducting tests are really nice to me. However, the doctors actually dealing with and taking charge of my care, not so much. So yeah, I can say that for the tilt table test, I can say that for the gastroscopy, I can say that for the breathing test I did a little while ago. Like, everyone who's been doing my tests has been really nice, which is good, especially considering the MRI I got in London was horrific. Everyone was awful. Everyone after getting the midline put in and before getting it taken out was awful. But yeah, they basically sort of talk through the whole thing. They can't really let someone else come and sit in the same room as you because there's so many of us in the room, but they do let them come along for like the whole talking through it, consenting part, then they send them back out to sit in the waiting room. I had to take a seat basically because I was very symptomatic. I'd been speaking to a couple of friends like literally right before leaving for the appointment. Evie in particular told me about the under the tongue spray, which I had also never been told about before, but they did mention it in this appointment, and I was like, oh yeah, my friend told me about that literally like 2 hours ago. They did also offer to rearrange the appointment for when I felt better, and I was just like, well, this is it. Like, if I'm not on my propranolol, I feel like this, and like this is half the problem is I feel like absolute dog shit if I'm not on some kind of medication to deal with the really fast heart rate. The doctor in there had read my file and was asking me like quite a lot of questions about my health conditions, but he was asking in a way that I appreciate, to be honest, from generally any healthcare professional. I don't mind answering questions that aren't relevant but are to do with my, the complexities of multiple health conditions and also the rarity of Takayasu's, for example. But yeah, so he was asking me in like a way that he was genuinely interested in learning more about my own experience and how I got diagnosed and what it's like living with these conditions. And yeah, I love to yap. I love to yap about myself. I love to yap about health stuff. So this was just another chance for me to yap. Also, it was a good distraction whilst I was being strapped into the bed. But yeah, he was asking me particularly about my hypermobility and my Takayasu's, a bit about family history, and there was a point when talking about the hypermobility and EDS, he asked, am I on the track for an EDS diagnosis and genetic testing? I said no one wants to do it, but if he wants to recommend I get genetic testing, go for it. because I've asked once before about genetic testing to my rheumatologist, and that was, I think, early diagnosis of Takayasu's days, I think, because I do have, I'm not going to be able to pronounce this very well, but a lot of connective tissue disorders overlap with their symptoms quite a lot, but there are genetic tests for quite a few of them. So I think I had asked about genetic testing to make sure I didn't have certain connective tissue disorders, and like the one that was coming up in particular was, I think, Loeys-Dietz. I can't pronounce it. It's basically just a rare connective tissue disorder because, like I said, there's a lot of overlap among different connective tissue disorders symptoms, and I just kind of wanted to make sure what I did and didn't have connective tissue wise, but yeah, it was turned down. I think because she was like, well, the hypermobile EDS doesn't have a genetic testing factor, and it's like, and when your symptoms overlap so much with other ones that do, then you probably should check that, no? Especially as I'm in like a weird limbo sort of phase where I don't know if I might have maybe classical EDS or classical like EDS or other kinds of EDS and not just the hypermobile kind. But even then, I'm not even diagnosed the hypermobile EDS kind, I'm just diagnosed hypermobility syndrome, which is also now just an old diagnosis name. So yeah, I was sort of like, if you want to recommend it, go for it, babe. I will not deter you. But obviously he's a registrar, so I don't know how much power and persuasion he has for any of that, to be honest. Yeah, so like I believe registrars are the level where they're starting to train in a specialty. I may not have this correct, because honestly, I know that the medical systems are different in different countries, so and like I struggle to follow any of them. I have no idea what's going on with Grey's Anatomy. I don't know who anyone is in Casualty. I don't know shit about any of that. So I had to Google this, and even though I've Googled it, I'm not really sure. According to my Googling, that's when they start training for a particular specialty. If this registrar is going into cardiology, he would likely be working with a lot of patients like me that have EDS and POTS, or even come across people with Takayasu. Sorry, it's really fucking windy. We had a really big storm last night. And yeah, even if he's not working with Takayasu's patients directly, because really you should be under the specialist teams before getting surgeries, unless you're in like absolute urgent need. You know, he can at least know some more details to identify it and direct them to the right testing, etc. Yeah, like Takayasu's in particular came up during this test as well, because they were trying to put a blood pressure cuff on my Takayasu's right arm, which like everywhere seems to do. Even though I've heard that you're supposed to put blood pressure cuffs on your left arm for a better, more accurate reading. So I don't know why they're always going for the right arm. So yeah, I was like, you won't get shit from that arm. You will not get anything. I will be dead, according to that cuff. Also, they were putting on another blood pressure cuff, but on my left middle finger. So yeah, that's sort of when the doctor came around to sort of talk to me a bit more about Takayasu's. And then, yeah, came to see if he could feel my pulse. And he was like, oh yeah, no, nothing. The tilt table test itself is, yeah, like I said, basically a bed that you get strapped to. They put the blood pressure cuff on your arm and your finger, and the finger one does feel really strange. I've never had a blood pressure cuff on my finger before, and it kind of just feels like a really strong pulse. Like I don't know how better to describe that, but you could feel it the whole time through. They also put ECG stickers on me, and yeah, they strap you to the bed. There's one sort of like across your stomach, chest-ish area, and one roughly around knee level. This is to prevent you like actually falling if you do pass out. They kept like really emphasizing that, you know, they're trying to like cause the symptoms to happen, but it is a controlled environment, so it's the safest place to be passing out. Because they're prepared for it basically, and they have a lot of preventative measures in place so that you don't injure yourself in the process. They then leave you to like rest whilst laying flat for a while to wait for your blood pressure and heart rate to kind of like regulate and calm down. One of the difficulties for me is that, yeah, the last few years my blood pressure has been creeping up quite a lot. It's something that I I'm pretty sure I mentioned in like my ADHD videos, especially my last one, but also definitely the first ones. This was commented on a few times whilst I was there. I did say to them, I was like, well, I've been on steroids for 4 years now, and they did say, like, the doctor himself like did agree that that's quite likely to happen, and could be why. Yeah, because before going on steroids, my blood pressure was in sort of the low normal range. Because yeah, I always used to get the comments of like, oh, your blood pressure's low, and now it's like, oh, your blood pressure's like nearly high. Yeah, like originally they said in the test that they would only do the blood pressure cuff on my arm once at the very start, but because my blood pressure has been on the higher side, they did repeat it a few times through the test, which for the most part was okay. But yeah, I really hate blood pressure readings now, partly because a lot of the cuffs are not big enough, so they have to go and get a bigger cuff because the small ones just unpeel themselves basically. But also I get a lot of like blood blisters from how tightly my arm is being squeezed, which I think is quite a common EDS thing, is like that fragile skin stuff. And also, yeah, because my blood pressure has crept up, it means that the blood pressure cuffs have to squeeze even harder than they used to back before I was on steroids. Slay! So yeah, they were testing it regularly throughout just to make sure. Even though they did obviously have the blood pressure cuff on my finger. I don't know, I guess there's a difference. There are some types of POTS that have got high blood pressure as part of it, but my symptoms at the moment seem to tick boxes across the kind of spectrum of POTS dysautonomia. And again, I'm not super educated on any dysautonomia in general. My symptoms kind of tick across different kinds of POTS, whereas I used to sit quite clearly in like a pretty classic, I can't think what the word is, a classic case, a classic case of typical POTS. So yeah, after the laying down for a while, they tilt the table up. It wasn't a full like 90%, but it was like not far off, so I was definitely still sort of leaned back a bit, and they do the tilt reasonably fast. I had some symptoms. They ask you to tell them like when you're experiencing symptoms and what they are, and they can note it down with like what they see on the screen with blood pressure and heart rate and stuff. So I told them and said that it's like not the worst symptoms, but it's like I got up from a chair too fast. Yeah, it wasn't like quite a dizziness, but definitely a wooziness is like the word that they provided for me, because I was like, yeah, I wouldn't necessarily say dizzy. I also said that I was like had developed some chest pains at one point on and off, which I think was partly the stress of being upright and being off propranolol, as I used to get this pain quite a lot before going on propranolol, and mainly from being upright for too long. I find that, yeah, quite a lot of people with POTS have a general orthostatic, so upright intolerance, and that includes sitting upright, which is why a lot of people end up being supine, which is laying down. It is also something as well that obviously can come from other conditions. It can come from high blood pressure, angina, or possibly other things, but so far nobody has given me a particular reason for me having this chest pain that comes and goes. But I do usually find it comes with being upright and or generally overexerted. But yeah, they asked me if I get this from Takayasu's, and I said that I just don't really know. Like I said, nobody has really like specifically said, yes, this is because of this thing. Again, it's that annoying overlapping conditions thing that is like, well, it could be several things. Your guess is as good as mine, mate. They left me standing sort of upright in that bed for about 20 minutes. They stated at the start that if I was okay after those 20 minutes, that they would then try the under the tongue spray, which I had to Google. If this is correct, it's GTN spray, so glycerol trinitrate spray. Who knows? Yeah, after the 20-minute mark, which basically brings on symptoms a bit more harshly if you haven't had them come on from their table tilt. So yeah, that's what I got. It was kind of a minty spray, and we kind of had a bit of a laugh because I said, oh, well, it's better than the gastroscopy spray, because they said, oh yeah, it can be kind of bitter. I was like, well, I'd definitely rather have that spray than the gastroscopy sprays I got. I also learned that registrars, or I guess before they become registrars, like I said, I don't quite understand the levels of things and how it all works. Doctors in training also get the procedures done to themselves, so they know what it's like to go through those procedures, especially if they're going to be providing this kind of care, which I thought was interesting. I didn't know that happened. I almost thought he was going to say, oh yeah, we do it to each other to get practice, not we do it to each other so we understand what it's like to be the patient in that situation, which is the reasoning that he gave me. But yeah, after the spray I felt okay for a while. I felt a little woozy for a moment. Mostly I was just really distracted by the pain that I was in from being stood upright for so long, but also unable to really move around. My sort of coping mechanism of like being in pain from standing up or being in the same position for a long time is that I move. A lot of the time I'll be, yeah, sort of swaying from side to side, foot to foot. If I'm sat down, I'll change my sitting position quite often. Yeah, so like I had completely numb feet. It was so painful, and my shoulders and neck were like really sore because I was just stuck in this like position. I didn't really know what I could do. And then yeah, suddenly the spray took effect. It definitely wasn't as bad as the real life experiences I've had, partly I think because there isn't the fear of passing out by yourself or being around like strangers or hurting yourself, but also I don't think I got the symptoms quite as strongly as I've had them in the past. So like I was thinking whilst I was laying there that I was like, oh, the room's not very warm, like I wonder if I'll even get this triggered, because a lot of the times heat is a trigger for me. When the spray actually took effect, I started to feel warm, which I guess makes sense. Your autonomic system basically controls the things that you don't think about. So yeah, like heartbeat, blood pressure, breathing, temperature control, things like that. So that was the first time I've had the experience of like not being hot prior to having like an attack, and then like getting hot when it comes on. And then yeah, I started to get really dizzy, and like as I was telling them that I was getting these symptoms, I also started to get like my weird eyesight thing. It has in the past been quite typical tunnel vision, but I don't think I could really describe what happened there. So yeah, they laid me back down quite quickly. I obviously did feel kind of nauseous with like the dizziness. With my real world attacks, I also like pour sweat. I'm not really sure if I'm gonna be sick, go shit or piss go. You know, like all of my body functions are just like out of my control, whereas like this was definitely not as many different things going off at once. And they did say that yeah, they did capture a big blood pressure drop from the spray kicking in. The spray is basically what is given to people having heart attacks, so it basically causes like your veins / vasculature to open up more, dilate I think is the word that they use, and be less restricted, and this is basically why it can cause or bring on POTS symptoms. Things like high blood pressure and ADHD medication can cause your vasculature to like restrict more, which is also why these are like some of the treatments that are used for POTS. Steroids and stimulants, there are specific brands that they use, but generally steroids and stimulants are used for certain cases of POTS. When they laid me back down, the symptoms eased off pretty fast. Yeah, I also get things like facial flush, chest pains, headaches and stuff too sometimes, so I didn't get any of those either. But I did start getting a headache because either because of the tilt table generally, or mainly the under the tongue spray. One of the main symptoms of, or like side effects rather, of that is that they can cause headaches. And because I'm already quite prone to migraines, I think it just really kicked off a bad migraine for me. But yeah, they got me really cold water afterwards, which was nice. The amount of times I've been handed warm water in hospitals, especially when I feel like I'm gonna pass out. That doesn't help. Get somebody some fucking cold water. Yeah, after I'd been like released from all the straps and stuff, I was pretty much good to go. The doctor also said to me as I was leaving that he would tell the doctor that I spoke to on the phone about what I'd said as like feedback, mainly about the being interrupted, and he didn't get all of my medications down, so I didn't get a full list of medications or symptoms, I think, which I think was nice. Yeah, thank you for providing that feedback to him, because I don't know if I'll actually ever come across that doctor again. I'm not really sure. But yeah, like I kind of said to them, I was like, yeah, I've got a long list of medications. Sometimes it can be hard to remember them, especially when I'm not necessarily prepared to give that list for an appointment. They have it all on their systems, so why do they keep asking me and not writing down the whole list or like checking with me from the list, you know? But yeah, either way, hopefully that man will stop interrupting patients when they're trying to give a list of symptoms and medications. Generally, I would recommend not going alone, as you may or may not have like continued symptoms after the test. And like I said about the spray, if you have the spray, it could set off things like headaches or migraines. So even though I was expecting to feel really like dizzy and sick, I didn't feel any of that, but I did have that horrific migraine, so I still wouldn't have been able to drive myself home anyway. But yeah, like I lost the rest of that evening basically because of how bad that migraine was that it set off. One of the frustrations for me with my health is that due to many conflicting conditions and symptoms, I can't really change a lot about my lifestyle, because changing one thing can impact something else that I've got going on. One of the examples is I'm often told I should eat better and eat more whole foods and things like that. But due to my Crohn's, I can't really adjust a lot about what I eat, as well as the autism too. Like, it really fucks with bad textures and tastes and smells, so I struggle. But like mainly the Crohn's, like I can't really change them because I'm not actually able to digest things like whole grains, and it does cause quite a lot of pain trying to digest those foods. So yeah, one of my issues with POTS in particular is a lot of POTS management is to do with like, oh, eat more salt, but I have high blood pressure and you're not supposed to eat more salt with high blood pressure. Stay hydrated. I already drink quite a lot of water most days, if not every day, and I'm still thirsty, which again, that is still something nobody's been able to find a cause for, because my blood sugars are fine. Be careful or like go slower, and it's like I already do. Most of the time I have bad symptoms, like more so due to the weather, muggy hot weather combined with not enough food or water being accessible to me, or the opposite where it's really cold outside, so you're dressed for winter and you enter into like a really boiling hot shop. That triggers it for me often. So I am taking things slowly. There are just things out of my control that like set it off, and sometimes it's literally I can't do anything about that. Wearing compression garments, I'm hypermobile. My hypermobile hands really struggle pulling on things like that, and also like not being a skinny / slim person, most compression garments are not made for fat people. So you know, where do I go from there? On a few sites they do discuss different medications that are available that are used, but also why they're used, which is really useful. I have linked that in the description, because I think I've maybe come across this site a couple of times, but like other sites just don't go into like detail as to like what medications are available and why they're used. I think I've said before, my steroids have definitely helped my symptoms in the last 4 years, particularly when the doses has been higher, because even though it's not the kind of steroid that they usually prescribe for types of POTS, they do use steroids in POTS treatment. But basically steroids generally cause salt and water retention, and that can cause a higher blood volume, which is the thing that I really struggle to like fully understand and comprehend. But that's partly as well why some people with POTS also get IV just like infusions of saline, because they lack blood volume. So I think the one they use is fludrocortisone, something like that, and that's the one that they mainly use in the UK. I think, though I have seen it under other names on other sites as well. And yeah, basically it helps reduce the amount of sodium lost in urine, but you will need to monitor your potassium levels on that. But yeah, it's interesting comparing the site Standing Up to POTS and their like medication page with the POTS UK charity page on medications, as the POTS UK page is mostly SSRIs. Can we stop just giving SSRIs to everybody for like everything, please? It's almost like they don't actually want to treat us, you know? And also doesn't explain the reasoning behind any of them, but particularly SSRIs. But the site Standing Up to POTS, which I think is just a .org, so I'm not really sure where it's based, probably America, but I'm not sure. But their site has a long list of medications that aren't SSRIs, and explains exactly why the meds are used and in what circumstances they would be used. And they also include sources to studies as well, which I think is really good. I think the main thing that I noticed that was really useful was actually These are medications that would be used if your blood pressure's high. These are the ones that would be used if you've got a lower blood pressure, and you know, things like that. They were really like clear and I think had like relatively plain language. So honestly, I'll probably be using that site a bit more often than the POTS UK one, because they just actually go into detail. The site also discusses things like COVID, long COVID, and POTS, which I've personally found quite relevant. My symptoms with POTS have definitely worsened post-viruses, and I feel like that's happened twice now. After my COVID infection I got in June of 2022, that's when I started to notice the just like constant recurring breathlessness, which is now still no cause found yet, but the test I did shows I breathe in more than normal people but don't get enough, like I can't convert the oxygen from the air into my blood. That's all I know, and it doesn't sound great, does it? And then yeah, that recent virus I had definitely set off more of my POTS-like symptoms, regardless of if I was on my propranolol or my ADHD meds, etc. And only now do I feel a little bit more okay. A little bit more well, I guess. Now I'm basically just waiting on the results and for a cardiologist to contact me about them and what to expect next. Hopefully I'll have some answers, even if it's not necessarily POTS, maybe a different dysautonomia or something else, I don't know. Mainly I would just like to know what it is that causes this, and if there's anything that I can get that actually does something. If it is POTS, then I definitely would want to try maybe other medications besides the propranolol. There are other meds that actually reduce your blood pressure that they use for POTS treatment, so maybe that'll be better off for me than the propranolol, I don't know. But also they say that they use that for people who don't respond well to beta blockers, so I feel like I have responded quite well to mine, but I guess we'll see. Hopefully they don't use the fact that I'm on it for anxiety against me and just say you're just anxious. But yeah, that's kind of the whole experience that I had. As an overview, I do have some resources in the description as well for this that might be helpful for anyone who feels similar symptoms to me, wants to know a bit more about this, if they know someone that they care about who has like POTS or a dysautonomia. Yeah, I think the only other thing that came up before with the cardiologist on the phone was that they were talking about exercise therapy, and I was like, well, do you have that? And they were like, no. And like, since finishing up with my physio in I haven't done physio, so I like, unless you are putting me on a program I have to go to regularly where someone is monitoring me, like I can't do it, mate. Like, the complexities of having multiple conditions, including things like ADHD and also the extreme fatigue that I experience and pain, is that it's not that simple of just going, yeah, here's an exercise thing for you to just do. No, babe, you need an actual like exercise therapy for POTS, funded and available for people to participate in. Back in the day, they used to have kind of like a physio exercise class linked to one of the hospitals near me, where that you could go in, I think once a week for like an hour or so and do your physio exercises just in the hospital. And like, that was a lot better for me. All I was paying for was parking at the time. There's no other fees, and I basically got to use a gym once a week, but also under the guidance of health professionals
who had no idea what they were talking about when it came to my hypermobility, but anyway, there were still health professionals there, and they actually made everything worse. So anyway.
So where the fuck is that? Put me on one of those, you know? Hook me up. Otherwise, you're gonna have to give me drugs, mate, even though you really don't fucking want to. So yeah, that's my video. Let me know if you've had experiences of tilt table tests, what they were like, where in like the country or the world roughly it is that you had that experience, because yeah, it does definitely seem to vary across the country, across the world, so my experience may not be anything like other people's experience. Let me know if you have any questions as well. But yeah, don't forget to support the video, which helps support my channel. Like, comment, subscribe, share my videos, and watch my videos, because the watch time is part of the main thing we've got to do. Watch time and subscribers is the main thing we gotta get up for becoming partner. So I really appreciate any and all support that you give in that way. And that's it for this video. I will see you next week. Bye.